here because we are all travellers. We love to travel, planning it, doing it, speaking about it. But most importantly, it is necessary to be prepared before we go anywhere. And not just the fun bits of itinerary planning, right? And thinking where we're going to go and what we're going to do, but actually the practical side of things. So passports, what state are they in? Do we need a visa? Have we learnt a bit about the language and the culture of the place before going? And are we prepared if something goes awry and we fall ill? Because apparently 1 in 20 Brits have missed, cancelled or postponed trips because of passport issues. Whether that's an expired passport. So apparently 3% of Brits have got to the airport and been turned away because of an expired passport.
Oh my gosh.
Which is painful to think about. Yeah. You get so far and then you fall at the final hurdle.
Yeah.
And apparently 40% of Brits, this according to YouGov research, do not learn any basics of the language before going anywhere, which is a personal pet peeve of mine. And it doesn't make us look great out there in the world as Brits because we're kind of maybe stereotyped for doing that. And then also, obviously, falling ill is something that none of us is ever going to plan to do, but it can happen to any and all of us along the way, whether that's food poisoning, a cough, a cold, flu, an infection of some kind. Hope, touch wood that does not happen. I've had food poisoning more times than I care to count. I wish I'd been more prepared. I think I am now with a bit more experience. I've been bitten by a dog in the leg, which is never on anyone's itinerary.
That's my fear.
But wasn't rabid. To this day, I don't think I'm rabid. So I think we're all good. Just check. So Yaya and Lloyd, have you ever felt ill on a trip, and how did you deal with it?
Yes.
Yes.
I feel like it's almost like a rite of passage sometimes.
Yeah.
And it's the worst thing you can have happen to you on a holiday, especially when you plan for so long.
Yeah.
But
I think so. I feel like my illnesses have been not as bad as yours. I feel like they've been more, maybe say like gastrointestinal. Like there's nothing wild. I think you're the one reason why we've been to hospital a few times.
literally,
Because like I think once you're sick, then you just kind of like it just keeps going and going and escalates and stuff. So we've had to do that, and I think it's in those moments you kind of just get really terrified because you can prepare for certain things, but there's some other things that you're like, wait, why? Where is the hospital here? How does this work? Like, how do I pay? What do I... Suddenly, all these thoughts come up.
you just realize you know nothing about the systems in the place you've gone to sometimes, and you're like, oh my gosh, like how have I arrived somewhere and don't understand what's going on?
But I think to that point now, I think it's the reason why now, like that preparation part of things is huge to us. I'm like, what are the medicines we need to bring? What are the things we need to have done before we show up? It's like a big thing because that experience, I would rather avoid it consistently, like all the time.
Shu, have you had anything? I feel like because your travels include lots of eating, food-related things.
Yeah, I have. And I think that's always why I always carry like a big first aid kit or just of everything possible. And actually, speaking of that, I recently got engaged, and within a few days of us getting engaged, we both picked up a food poisoning or a bug or something. So it was very romantic to both actually be in close proximity of the bathroom with each other after deciding to spend the rest of our lives. And I'm going to marry this man, and I now know for certain we are getting married after this. But I think, being able to know like where the nearby doctors are, pharmacies, but also like it can be nerve-wracking when you do pick up a bug and actually having to communicate to a pharmacist, trying to like say what symptoms you've got, trying to ask like what would help with the symptoms, trying to communicate that in a different language. It can all be quite nerve-wracking. So I think being prepared is also like the best way to go.
And also we can plan as much as we want, but we're never going to know.
No,
Exactly. I mean, I've been ill in the UK.
Or how your body
Paris
will react or anything.
Yeah, so we don't know.
Yeah.
But onto more exciting things as well. Maybe less of the illness talk. Onto travel trends and how Gen Z young travellers are changing where they travel or how they travel. Particularly, obviously, since the pandemic, I think we're all thinking of things maybe in a different way. There's definitely a tendency for more adventure travel, really immersive travel. I think I can probably speak for all of us that wanting to switch off a bit more, go to maybe more remote places, is more appealing, more attractive, but also maybe comes with other needs that we have to prepare for. If we want to go to, a wellness retreat in the middle of the jungle or hiking up in the mountains. And for this reason, apparently more and more people are traveling to places like Southeast Asia, also because of budget concerns, obviously. It's known as maybe a more affordable place for us to go and travel to. So I would love to hear about each of your travels to Southeast Asia. Shu, you mentioned Vietnam.
Yes, I was recently there at the start of the year, and then that involved a lot of more slower travel and a lot more focus on homestays now. I've noticed
so
people
nice.
doing slow travel and wanting to be able to be away from the major cities and actually being able to switch off. And whether that's looking into wellness, whether that's wanting just to be able to just have some TLC and just not have any internet or anything bothering you. But being in a rural place obviously means that you're then a lot more susceptible to things like insect bites or anything like that, or catching a bug and not being able to go to a local pharmacy and things. But I've seen loads of Gen Z and loads of vlogs of just being okay, I'm going to take a 6-hour train away to the middle of nowhere and I'm going to stay in this hut in the middle of nowhere. Last year in India, I was staying in a desert for 24 hours there as well, and it was nothing. It was just one little cubicle that everybody was awkwardly trying to brush their teeth and clean and stuff. And I'm wow, right now I'm about to stay outside, sleeping outside under the stars 24 hours, and I have nothing, no home comforts or anything. But now I think post-pandemic people are really craving that switch off and that very affordable, value-driven, adventure-driven trip or
Definitely.
things.
I think as well as people are actually looking for authentic travel experiences as well nowadays. I think, maybe 10, 20 years ago, people gone are the days of the 18 to 30 kind of booze cruise kind of holidays. I don't think Gen Z is looking to do that anymore. It's more about immersing yourself in the culture of a place, slowing down. And I think, we travel quite a lot around Southeast Asia, and I feel predominantly we go there because it's rich in culture, history, and it's relatively safe. And that's a great tool or a great aspect of travel that makes it such a great region to go to.
Yeah, I think you're right about the fact that people Gen Z actually really love the idea of kind of slowing down and actually experiencing the places. And I think now more than ever we have so much information at our fingertips now about places that you probably wouldn't have known to visit.
So we've spoken about getting ill on our travels, particularly from food or it's flu or cold. But there's also a rise at the moment of mosquito-borne diseases or instances of them. And I guess serves to remind us that mosquito-borne diseases exist in the world. But luckily we have a doctor on hand to tell us about mosquito-borne diseases in general. Can you tell us about some of the most common ones that we all need to be aware of?
Yeah, so malaria is obviously the big headline. We know that there's over 250 million cases a year. That was in 2023 at least. So a lot of cases. Not to stress anyone out, most of these cases are in people who live in affected countries, but some of us will go overseas and potentially pick up malaria. So that's the big one. But I think most of us have heard of that. Most people are aware they take antimalarials, and that reduces the risk considerably. But there are also other mosquito-borne diseases that we need to be aware of. There's dengue, there's Zika virus, which made the news, mainly affecting sort of South America, but also Southeast Asia, and that made the news a few years ago, and things like chikungunya as well. So there's a whole wealth of different diseases and conditions that mosquitoes are also responsible for, alongside malaria.
Chikungunya, what is that? Please tell us more.
So the word comes from the Makonde language from South Tanzania. It means that which bends up or stooped walk. It refers to some of the symptoms that patients with chikungunya can develop. Things such as joint pain, joint swelling, fevers, and things like that. It's a viral disease, so similar to dengue, similar to Zika, it's a virus. And it's increasing in sort of severity and frequency. They're getting more outbreaks, and it's largely, it's unfortunately a result of things that humans are doing wrong, so we're starting to affect the climate, which means that mosquitoes are starting to migrate to places they didn't used to be in. we're seeing more outbreaks as that sort of human-animal interface starts to overlap and interact more. So it's something that should certainly be on our radar.
And how they always say that prevention's better than cure, right? So how can we prevent contracting chikungunya? I guess it's about preventing mosquito bites.
Yeah, and it's important to present because I've sort of alluded to a few things. It starts off with fever, as many tropical infections, even things like the common cold can cause fever, but you can also get joint pain, joint swelling. You can feel quite unwell with it. And we know that in around 40% of people, they can get longer term consequences as well. So that joint pain, that sort of low energy, musculoskeletal pain, it can affect mood and things like that. And sometimes these symptoms can last for sort of months to years. So emphasis on prevention is super important. Well, for all of these conditions, not just chikungunya, for dengue, Zika, malaria as well. The good news is that coming to see someone like me, so coming to see a healthcare professional, there are vaccines now emerging for most of these conditions, pretty much all of them in fact. So there are strategies out there. Simple prevention measures, we probably all know, it's things like wearing long sleeves, insect repellent. It's common sense, looking at the windows, have they got nets on them? If we're sleeping outside, it's really tempting to just lie on the beach or lie somewhere and just be like, it's me under the stars. But then you'll have mosquitoes and other things joining you. So being under a net, some sort of mesh, like the inner of a tent, something like that. Basically, if your skin is exposed, it's a nice tasty snack for a hungry mosquito.
Mosquito buffet.
Are mosquitoes active mostly or only at night? Do we need to be aware 24/7?
Yeah, that's a really good question. So yeah, they're still about during the day and then in the night as well. So yeah, just because you're sleeping under a net or you've got the appropriate protection on your windows, you still might get bitten during the day, and a lot of the time it's the mosquitoes that are active in the daytime that carry some of these illnesses.
So then, rather than relying on just self-research on the internet, how soon after you book a trip should you be speaking to a health professional?
That's another really good question. So I think ideally, and this might be a surprise, but we ideally want people to go and see their travel health provider 6 to 8 weeks before they're due to fly. Okay. And this is for a few different reasons. Obviously, we all want to be up to date with, everyone in the UK should have their routine immunisations and things. There's still a risk of us getting tetanus and things like that overseas, so we want to at least be up to date with the ones that, the risks and the things we might be exposed to here. But then you might need a course of something else to prepare you for when you're overseas. I know you mentioned your animal bite. So things like having the rabies immunisations, things like that. Talking to your clinician about anti-malarial tablets, because yes, you can. We won't go too much into detail, but there's a few different anti-malarial tablets. Some of them are good for certain people. Other people, if they're on certain medications or they've got pre-existing medical conditions, might need other ones. So it's not something you want to leave the day before, the week before. Try and get a bit of time into.
And not an afterthought.
What are some takeaways or changes that you're thinking, or things that you're going to be more aware of going forward?
More long sleeve shirts, for sure.
Yeah.
Definitely.
Bug
and then
spray.
empty the ponds. I'm just kidding.
Yeah.
No, but I think definitely being a lot more aware of even things like, say, traveling travel size packs of mosquito repellents. Also checking the prevalence of it as well, because I think that's something that you kind of. So, for instance, we were in Texas up until last week. Never thought of mosquitoes there. I don't know why. I just thought. I thought heat. I thought maybe even alligators or rattlesnakes. Never thought mosquitoes, and it was wild.
We got bit so much.
And this is in the city centre as well, in suburbia near a lake or something. So I think that part was kind of a bit of almost being extra vigilant, and actually doing a bit more
Don't get caught
research,
out.
research about it kind of thing. Because now I think we got bitten, and then it was mosquitoes carrying chikungunya. Yeah, they carry. Till now, I have no idea. I never did that research as well. I think it's just check-in as well.
And the biggest one is actually speaking to somebody 6 to 8 weeks before a trip, as opposed to being a week or a few days to go. Be let me just rock up to the doctor and just tell them where I'm going, about to go on a safari, and then you should have seen me 2 months ago, kind of thing as well. Because I think sometimes you're I'm sure it won't affect me, and then you're there covered in bites and not feeling very great, and you've ruined a trip, and then you're should have just like added it to my packing checklist
Yeah.
and stuff.
I think
to
that's
do.
it, isn't it? If we normalise it and it
Yeah.
becomes part of that process,
Yeah.
because it's an inconvenience, right? Coming to see someone like me, or seeing a doctor to talk about your travel plans because you want to just get on and do it. But it might be the difference between having an awesome trip with no issues, or maybe having to go and see someone that you don't want to see once.
And no offense, but nobody wants to see you on their holidays.
And it comes down to those exact same themes that we've been talking about. If we've done our research, if we've done our planning, if we've maybe asked people in advance about their health and things like that, hopefully we don't have to use most of the stuff we brought with us. But it's obviously nice having it just in case.
Just in case.
Yeah.
The other thing to sort of think about is that some of these conditions, some of these sort of viral mosquito-borne stuff that we've been talking about, there is emerging vaccines for some of them. You know, there's a vaccine for malaria as well now.
Is there?
Yeah, so it's being rolled out largely in the African subcontinent. So there's a lot of progress, and it's an exciting time for travel medicine.
Well, thank you everyone for taking the time to help us all travel more wisely, be more prepared, and enjoy our trips. Ultimately, that's what it's all about.
Yeah, absolutely.
Sure, yeah, thank you.
Thank you so
It's been really
much.
fun.
It's been so fun.